Question number 1. Which drug used as the first line for postmenopausal females with osteoporosis? Bisphosphonates. Elderly female, presents with pain and swelling in the thigh. X-ray shows multiple lytic lesions in the distal femur with no reaction. Aspirate shows serosinuclear with RBCs, blood filled. Which investigation can confirm? So this is a brown tumor. Serum PTH will help me to confirm. 75-year-old female had a fall and an intertrochanteric fracture. Most important baseline disorder, osteoporosis. Minimum age for screening of osteoporosis in females is 65 and males is 70. Ivory vertebra is seen in, the answer here is Paget's. Single answer here. But we have done the mnemonic for ivory vertebra. Going to X-ray changes seen in rickets. So you have cupping and splaying and flaring. So you have metaphyseal cupping and splaying. And you don't have calcification of Dearmedicoz. That's Wimberger ring sign seen in scurvy. You have widening. Sclerotic ring around epiphysis. Again scurvy. Celery stalk appearance. Congenital rubella or degenerated ACL. So A and C are the answer. What is the likely diagnosis of this image? You have reduced neck shaft angle, coxa vara. 75-year-old female has a chronic backache. X-ray of the spine is showing you codfish vertebra, osteoporosis. All the following are used in osteoporosis except I told you milnacipran used in fibromyalgia. Paget's develops in 6th decade onwards. So 7th decade is the answer. A person is hemiplegic. Changes in the bone mineral density will be seen in humerus. Upper limb more than lower limb. Proximal more than distal is the rule. That's how you lose the bone stock. A 2-year-old child has rickets, is on calcium, has a foot deformity. When will you correct? You have to correct the deformity with an osteotomy. You have to see that the growth healing becomes normal. On an X-ray, you see the white line of healing. Regarding osteoporosis, all the statements are true except. So osteopetrosis, all the statements are true except pancytopenia is seen. Delayed fracture healing is seen. Cranial nerve compression is seen 2nd, 7th and 8th. Infections are seen. Osteometal is characteristic. But delayed fracture of healing here is minus plus. So that is the answer. Debatable question, but if it comes, this is the answer. A 3-year-old child presented to an orthopedician with deformity of the limbs. The X-ray was ordered, which is showing you cupping, splaying, flaring. Answer is rickets. 28-year-old lady presented with nausea, vomiting, abdominal pain. So this is abdominal groans. X-ray shows lytic lesion in the metacarpals. So there's a classical dictum in which you pick up hyperparathyroidism, which has bones, means lytic cavity, stones, renal stones, groans, abdominal discomfort, moans, psychic moans, irritable behavior. So here you have nausea, vomiting and abdominal pain, abdominal groans, located lytic lesions in metacarpal bones. So how will you diagnose this? PTH and calcium levels. Drugs decreasing bone resorption in osteoporosis all except teriparatide because it increases, directly activating the osteoblast, increases the bone formation. And the last question, 36-year-old lady, male from Bihar with fluorosis. What will you see? Osteosclerosis, because fluorine directly stimulates the osteoblastic activity. So this was about the metabolic disorders. Remember, white is scurvy, wide is rickets. Thank you.